Daniel, please introduce yourself.
Nice to see everybody. Hi, I'm Daniel Seidler, TelePT Solutions. I'm a physical therapist and I owned a practice for 15 years, sold my practice, and the company that I worked for 2 years ago somehow bought into my pitch to do telehealth. So I developed the telehealth program there. The premise there was to grow the practice, make up for cancellations and no-shows, cover for snow days and hot weather days when patients weren't coming in. We also had a lot of cancellations from pediatric patients. A brother or sister would get sick, or a patient couldn't come in because a kid was sick. So we recognized that there was a big opportunity there to connect with patients. And even if it was just a portion of our cancellations and no-shows, we could really build on that. And they were doing telehealth about a year ago, and they were prepared for this moment. I left 9 months ago and started my own thing based on the policy and procedures that I put together for them, program that I developed, and now I'm doing it with practices around the country. A bunch of you guys who are listening here today, I've been working with you, and it's been really wild. You know, things were kind of trudging along, and there were a bunch of practices that understood that someone like John, John realized, John is not a client of mine, but he recognized a while ago that this is a great opportunity to connect with patients, inbound marketing, cover no-shows and cancellations, and maybe it would build to something. And, you know, it all kind of happened very fast for a lot of people.
Yeah,
and now
I think
Go ahead, I'm sorry.
No, I was going to say, and you bring up a good point when you say that there's a specific set of policies that you have to implement. You know, there are some things that you have to put in place, and a lot of these have been lax since, you know, COVID has happened, and there's like going to be a window of time where things are going to be lax. But long term, if you're going to continue with telehealth services, there's some things that need to be put in place. Can you share just a couple of those that, you know, people might not be like on their radar?
Yeah, sure. I think most everyone's aware that they're going to need a HIPAA compliant platform. So, you know, it needs to be a secure line to from the PT to the platform, from platform to the patient and back. That's sort of an obvious one, but it's going to require following a particular set of rules and regulations. Security is big, and I think that that's something that's going to happen across physical therapy and medicine as healthcare becomes more and more digitized. So much information is being transferred digitally. PT practices are really going to have to be on top of this to make sure that their information is secure. A breach in security is enormous. I mean, that can really like bring down a practice for a significant amount of time. You know, and as you're becoming more and more digital, as you're going online more, you're exposing yourself to more of those things. So that's something that should be in any policy and procedure manual related to telehealth, but also as part of a practice's digital security policy.
I think we have to remember too, you know, and I think Daniel will chime in on this as well. An e-visit and a telehealth visit are actually two entirely different services.
Yes.
Right.
So just keep that in mind, right? That wasn't the intended purpose. I know a lot of people just jumped on e-visits saying, well, that's all we can do, unfortunately. And you ran into that, Allie. And I think Daniel and I were like screaming about it in the very beginning, like, wait a minute, that is not what an e-visit is supposed to be used for. Right, Daniel? I mean, what were you telling people?
Yeah, I mean, exactly that, Brian. That they really were just intended as check-ins, you know, as if you make a phone call with a patient, or you text or email with a patient, or, I mean, literally it was supposed to be they put a message into a portal. You know, the HIPAA regulations were relaxed on that, but, you know, patient asks a question, you actually spend the time to respond to their question, help them solve their problem, and then you can bill for that time. Much like every PT has had either an email conversation or phone conversation with the patient, like, that was like a half an hour of my time. I should be able to bill for that. That's what an e-visit is.
Right.
Yeah.
Right. And I think the statute actually says to clarify, to reduce confusion, to solve a problem. It wasn't necessarily to treat your patient.
You know, when I put together the first program I did, it took at least 3 months. Because we hired, and you know, there was research. No one was doing the information, just wasn't there. So I had to do the research and really figure out policy and procedures. and how it was going to fit into the framework of everything else we were doing, there wasn't this kind of pressure on it. We ran a pilot, and we had sample, we did some videos, we did some sample visits, things like that. In this environment, I've been getting people up in less than a week, partly because just the information is there and the resources are there now. There's also the urgency, and I've also recognized that you can do it on the fly. The one benefit of this environment is that there is some leniency as you're growing it, right? Mm-hmm. I mean, I think John and Tyler can both attest to this, that they definitely made some mistakes along the way, but they corrected as they were going. And you have that sort of liberty at this stage. I mean, I think as things progress, you're going to have a plan. You're going to have to have your ducks in a row before you go full force with it. And, one of the most important things, I'm sure they can also attest to this, is having everybody on the same page. Your whole staff has to know that you have a telehealth program and it is an option for your patients. And they need to be able to talk the talk also. They need to know what's going on in those telehealth visits so that they can explain it to patients and explain the value that a patient is going to get from this. PTs, these guys said it also. Beyond manual therapy, the value of PT is in, and a quality PT is their knowledge, problem-solving skills, and compassion. And a lot of that happens through telehealth. And everybody in your office has to understand that. It's not just the PT who's delivering the care. It's also your front desk. You want to get that message across to your docs as well. I mean, your docs need to be telling your patients that you need physical therapy. And even though you're not allowed to leave your home, you need physical therapy. So you're going to do some telehealth visits because it's going to be valuable to you. Your therapist understands how to do this. They're going to bring that value of their knowledge, of problem-solving skills, their compassion. They're going to help you. So I think it has to be a 360 view.
I think that's a good point. I think that's a very good point.
That's the patient buy-in side of it.
Yeah, sure. And what I want to ask, because I think you bring up a good point with, communicating with the doctors, the active owners right now, how are you communicating with the doctors, or are you sharing the testimonials that you're getting with patients? Like we would say, share your success stories. With
or that
the
video,
doctors.
Nicole, or that video that John shot, which I thought, John shot that video and sent it to the workers' comp. Why wouldn't you send that to all your referring physicians?
And obviously, we're all talking about how the landscape of physical therapy and how we treat is going to change, permanently. This is going to not be something that goes away. And there's going to be some tools and strategies that we're going to have to equip ourselves with in order to be successful, even post-pandemic. So I do want to get to the second part of our conversation and talk about re-engineering your clinic. And Brian, took a lot of time and energy and effort to put together this wonderful, we're calling it the operational playbook, the COVID-19 operational playbook, where it's a 10-page document where he really maps out a lot of those strategies and policy suggestions for what you can implement. So I'm going to hand it over to him and have him touch base on that, so you can better understand what that's all about.
Yeah, absolutely. Thanks, Nicole. And this is a great segue. It kind of rides on the example I gave of the patient who tried to make the accusation about this is a financial gain for you to use telehealth. My little bit of advice on that, and then I'm going to get into the details of this operational playbook we put together, is whenever somebody comes at you with some antagonistic comment that is off the beaten path of why we actually exist, like why we're actually here as a physical therapist, as a doctor of physical therapy, trying to provide help and care to our patients, I never pick up that piece, like that financial piece. I would never pick up that argument. I would boomerang right back to the concern. So your concern is initially that you really want one-on-one care because you want to be better protected and treated in a safer environment. What better, safer environment is there than the comforts of your own home? Instead of looking at this as a financial thing for us, because it really doesn't have any different impact to us financially whatsoever, it allows us to treat you in a safer environment, in a unique period of time at your choosing, where we can provide that one-on-one care that you're actually asking for. All I ask of you is, if you trust me enough to be your physical therapist, to come in here 3 days a week and allow me to put my hands and work with you and treat you, then trust me enough to take this advice or this judgment to try the telehealth visits at home. And if that fails to meet your needs, you fail to feel like you're making the progress, we will come up with another strategy that will obviously appeal to you, and then we'll move from there. So I always take it from a patient advocate point of view. That's what we teach in MEG Academy. And I just wanted to leave that message. So I wanted to end with, no matter what the criticism is, no matter what people come at you for, and any kind of antagonistic, negative kind of comment, just always take that patient care advocate response. I believe it's always going to be the right response. So in keeping with that, it was about a week ago, I realized that, oh my gosh, I've been spending like 2 weeks, 3 weeks handling PPP questions and EIDL questions. And how do I get my forgiveness in? And John's going to seminars and you're giving me information, John, and all of us are sharing all this information, and I'm like, all right. As of our last week's live Zoom chat with Nicole, she had a whole team on there, and we attempted to try to move everybody's focus from stop focusing on the money and stop focusing on the details of this forgiveness, and get your head up over the landscape and look ahead and start focusing on the new operational paradigm. Start focusing on what your business is going to look like 3 to 6 months out, because that's what a CEO does. Tyler's running multiple offices all at once through this whole pandemic. I mean, what do you got, Tyler? 11?
11. Yep.
11. I mean, he owns the concern of all of those patients, of all of that personnel staff, and of his entire community. And so do you. Those of you that are here on the show watching this, you have that accountability responsibility. So if you're not thinking with where are we going to land 3 to 6 months out, I'm telling you, nobody else is. Everybody's watching the news on a day-to-day basis. Everybody's worried about tomorrow. You've got to create the future. So what I did was I said, the new future is going to have an environment shift, a personnel policy shift, and an operational practice management shift. It's going to be a new structure. It's going to be a new way. It's not going to be physical therapy 1995. It is not going to be the way it is. So let's just start with breaking that down. And so I started attending lawyer webinars. I started attending the SBA webinar. I started reading the CDC guidelines. I pulled up the OSHA guidelines. I reached out to Daniel Seidler and said, Daniel, what's your policy and procedure looking like? What are your updates? And he's like, I'm pounding away on it right now. I'm going to have this thing done tomorrow. And he goes to link me in, and it whole failed and stuff. I don't know what's going on in Long Island out there. I think the hamsters fell off the internet wheel. We couldn't connect. So he sent me a PDF of it. He put together an awesome policy and procedure manual on how to run telehealth. So I'm looking at all of these things, and I just started combining them because I wanted to share this, because I know there's not one government agency that's willing to stick its neck out and say, hey, here's the new proper workplace environment. They're all giving suggestions. Everyone's trimming around the edges. So I pulled the CDC, I pulled OSHA, I consulted with a national compliance officer, Daniel, reached out to another Daniel, and Daniel Hirsch, and he's a national consultant in compliance, pulled him into it, pulled all this together, long hours. And we put together a 10-page operational playbook. And we are going to literally discuss what is going to be usual and customary, what is going to be normally acceptable for you to have that safe work environment to move forward in the best interest of your patients, in the best interest of your staff, but also keeping in mind in the best interest of your employees as an employee status, but also as the practice, right? As a business model. So certain things, depending on where you are, going back to John's term, which I thought was awesome, patient behavior, certain patient behavior geographics, you got to get rid of your waiting room. I mean, you can't have a waiting room. The parking lot is the waiting room. They're going to come, they're going to call, I'm in the parking lot, you're going to buzz them up, they're going to walk right on through, the door should be open, no need to grab a door handle. Your COVID-19 sanitization policies are going to be posted on the door for them to read. They may get it handed to them when they come in. There'll be a PPE mask given to them. There's going to be proper donning and doffing protocols for them to use the mask, proper hand sanitization, proper, disinfecting policies for the equipment. You should put it on your website. You should be pushing it to your patients. You should be sending it to them before they even show up. Look, confidence breeds trust. You have to build confidence in your patient by being consistent. This is the number one thing I hammer everywhere else I go. The reason why we designed MEG Academy is because we can consistently teach and train 11 front desk staff members how to do it the same good way every single time. That has to have driven you crazy, Tyler. You must have pulled hair out at times. Like, why is the training like half in, half out? We're teaching the same people, but they grab onto different emphasis of different things, right?
Yes.
And you're like, what's the deal, man? It's the same. So I just booked it all out, mapped it out. You're going to have an environmental barrier. You're going to have a plexiglass shield at your front desk for a while, if not long term, or a glass window. I mean, these are things that they're looking for. This is the big thing CDC is asking for us to do as medical health providers, is what is the engineering you're doing inside your office? What engineering is taking place? Just like you see the sneeze guards at the grocery store, right? Just like you see there. I mean, where Nicole lives, there's no grocery store. It's butcher and baker, and it's the same thing you see on Beauty and the Beast. She still strolls down the street with her basket. That's how it rolls in Wisconsin. It's just that kind of thing. But for the rest of us, when you go out, you're gonna need to really consider like how you safeguarding that environment. You know, I did some research and I came up with this thing called the Minisa 2 Ultra Quiet Air Purifier. Matthew's going to put a link in there. It's called the Rabbit Air. Look, I'm not a virologist or epidemiologist or anything like that, but from what I read, that is a very high quality, very good option for you to put into your office that's going to circulate the air, disinfect the air to a certain degree. It's used by other healthcare institutes. Go to the website, check it out. We're going to give you the link on it. By all means, check that out. So for those of you who are really looking for that level of help, Nicole, we need them. We don't know who they are, so they need to come in and attend so we can talk to them, so we can tailor make this. What do they do? How are they going to engage us so we can help them by giving them this playbook and answering all their particular questions and helping them restructure their clinic potentially long-term? How do they get engaged with us to do that?
We do what's called a practice assessment, and that's what you would sign up for. Matthew's going to post the link up for a practice assessment. And basically what that means is I'm a clinician. I'm a clinician first. I was a physical therapist for many, many years in the clinic. And I always like to think of it as like an evaluation. So we're going to basically go through and learn the particulars about your specific clinic in your region. I mean, you heard two different practice owners today. Idaho is a different landscape than New Jersey. I mean, wherever you are is going to look different, I'm sure. So we run down all the particulars of your location, of your particular practice. Some people have 11 clinics, some people have 2 clinics. We learn about you and learn about your specific barriers.
So the first one's from Michelle. She says, do the Medicare telehealth CPT codes differ in reimbursement from the e-visit codes?
Daniel, maybe you can jump in here too. I'm assuming yes, they do, but I didn't see any clarification that they're going to pay in parity to what you would get paid for an office visit. Have you heard differently?
I haven't heard anything, but my expectation is that they will. It should be the same as in office. No guarantee on that, but that's what I'm expecting. I mean, the whole premise of allowing for telehealth is to allow PTs to see Medicare patients is for PTs to get paid for it. The whole waiver, the whole wording of the waiver is that's what's going to happen. So we'll build the same codes. I'm sure that there probably will be modifiers and place of service, things that we'll have to add to that. Allie, you're going to get that information before I do. But I would expect that they'll pay at par from in office.
But needless to say, it's definitely not going to be paid at the same as an e-visit.
Oh, definitely more than an e-visit.
True. And hopefully we'll never have to see those G e-visit codes again.
That's another question that somebody brought up is it okay to transition if you've been doing the e-visit? Can you transition over to telehealth? And I would imagine that yes.
Yes.
There shouldn't be a reason why you wouldn't be able to do that.
Why not?
And Daniel, again, thank you for joining us. I know you've been a panelist before and have been tremendously insightful in the telehealth world. So can you please give some closing thoughts as we wrap things up?
Thanks for having me on again, Nicole.
Of course.
And
Our
Brian.
pleasure.
Always a pleasure here and an honor to be on here with these distinguished panelists. I'm really impressed with some of the things that you guys are doing, John and Tyler, Mike going out on your own too. Pretty impressive stuff. I think my anticipation is that a year from now, when things are a little more settled down, a little different than what they are now, I think that there's going to be a need for for PT practices to survive and thrive, they're going to need to be 20% remote. You're going to have a remote, a telehealth portion of your practice. You will need to have the CDC and the OSHA, and you're going to have a safe environment. People are going to have to feel safe coming into your place. But what's really going to happen, the real effect of this beyond the sanitary environment and the changes that you're going to have to make in person, is that people's behavior is going to change because of this. Part of it is maybe a hesitancy, but the other part is the convenience. A lot of people are recognizing how actually convenient and effective telehealth is for all their medical care. Everything from going to the doctor to veterinary visits to PT in particular. So it needs to be a part of everyone's strategy. And if it's not, you're likely going to lose that 20% of those patients. They're either going to go to somebody else who's offering telehealth locally, or there will be national providers who are offering telehealth. So patients want that convenience. They want, whether it's convenience or safety or whatever their motivation is, like John said, what the patient actually wants. Whatever their motivation is, there's going to be a market for this. So it should be part of your practice.
I totally agree. And I love what you said about the, cancellation no-show. I mean, you really don't have much of an excuse to not do a telehealth visit.
Yeah.
If you can't make it in because of transportation, I mean, that's one of our number one reasons that we have to combat against. So, okay, well, let's do it. Let's do it now. Turn your computer on. So that's good advice. Thank you, Daniel.